Okay, I think we're going to kick off. People will be rolling in as we go, but we want to get started because we've got quite a bit to cover. Welcome everyone. I'm really pleased to welcome you to Taking Relationships Seriously, Findings from a Realist Review of Community Engagement. This webinar is brought to you by the Global Health Network and its knowledge hub MESH, the Community Engagement Network. I'm Dr. Robin Vincent, a social anthropologist and independent learning evaluation and research advisor based in the UK and part of the REAL team. I'm going to facilitate the session today, and I'm delighted to be joined by Professor Dorcas Kamuya, Wellcome Trust Society and Ethics Fellow based at the Kemri Wellcome Programme in Kenya. We also have Professor Sassi Molyneux, Professor in Global Health at the University of Oxford and a senior researcher at the Kemri Wellcome Programme. And we're going to be joined also by Professor Paek-Yong Che, who's a Professor of Global Health at the University of Oxford, but also based in Bangkok, leading the Bioethics and Engagement Programme at the Moru Tropical Health Network. And she's going to give us some reflections after we've given a presentation on the findings. We also have Adam Dale from the Global Health Network team and Helen Latcham, who's the MESH coordinator, who are going to help us with production of the session and any technical issues you may have. So do message them in the chat if you need help with anything in particular. So in the session, myself, Sassi and Dorcas are going to give you a bit of background to why this review of community engagement literature was needed, how we approached it, and some of the main findings. We're then going to have an initial response from Paek-Yong, and then open things up for questions. But before we get started with the presentation, I just want to run through some of the housekeeping for the session. So the webinar is going to be an hour long and it's being recorded, and we'll make the recording available on a link that will be shared in the chat. Because of numbers, participant videos and microphones have been disabled. So we invite you to use the chat box to introduce yourself and post any comments, bearing in mind that you've got the sort of private or message all options on the chat. But we're going to use the Q&A box, which is on the bottom right-hand side on your screen, to submit questions throughout the session. We're basically going to try and protect about 20 minutes at the end to be dedicated to questions and answers, where we will try and answer as many of the questions as we can. And those that we can't answer, we'll try and respond to afterwards on MESH. So please do take the opportunity to add your questions throughout the session. And then the materials for the session, including the recording, are all available on MESH, and there's more background information on the REAL review on MESH as well. There's also more information about future events. So that's the housekeeping. Now we're going to move over to the presentation. And myself, Sassi and Dorcas are going to take turns on that. So I'm going to hand over to Sassi to kick us off.
Thanks very much, Robin, and welcome everybody. Thank you so much for joining us for today's session. As Robin mentioned, over the next 30 minutes or so, we're going to give you a bit of background as to why we conducted this realist review, talk through the processes involved, and then introduce you to some of the outputs, not only the publications, but also the policy briefs, and we're actually going to show you an animation that summarizes the findings. So one of the things that we wanted to highlight from the beginning is that in this realist review, we're focusing on malaria trials and community engagement for malaria research. And we're doing that really as an illustration or as a tracer for relatively large-scale international research programs being conducted in LMICs. And what we'll be really interested to hear from you all about in the session that's open for discussion later is the relevance and applicability of some of the findings for other contexts. So in terms of how we're going to organize this session, I'm going to begin by giving you an introduction and rationale for this review, which we call the REAL review. I'll then hand over to Robin, who will talk through in detail the process involved in conducting this realist review and the realist logic of analysis, as well as give an overview of the findings from the review. And then we'll hand over to Dorcas, who will talk about the implications and recommendations that come out of the findings. And last but not least, we'll have Paek-Yong, who will then follow up, giving some of her reflections from her point of view on the findings and the implications of the review. Next slide, please. So why did we conduct this realist review? So many of you will be aware that there's been significant investment in community engagement and health research, especially over the last 15 years or so. And this investment is based on a wide range of assumptions about what community engagement can achieve, about the value of community engagement. So there's a really broad range of arguments and hopes of community engagement. These include, for example, if you engage with communities on, for example, appropriateness of consent processes in local contexts, for example, about what types and level of benefits are good to give without inducing or minimizing the risk of inducement to participate in research. If you respond then to that engagement with community ideas, you can improve the ethics of your research practice. Another set of assumptions is around if you engage with communities on, for example, where procedures should happen, make efforts to reduce the level of complication for community members to be involved in research, you should be able to increase the success of research happening, so the science quality. And another set is around if you involve community members early in the research, they become invested in the research, they're interested in the findings, more likely to uptake the research findings, and so the impact and outcomes of the research are improved through community engagement. So it's these kinds of reasons that have led to many funders and implementation partners supporting community engagement. There has been, in response to this level of increased activity and investment, more and more research to try and see if these assumptions about the value of community engagement are held true in practice. And this research has begun to show that many of these assumptions do have some validity, but there is still a lack of a robust evidence base around these assumptions. And this is a challenge for informing how community engagement activities may be strengthened. On to the next slide, please. So there are a series of challenges, not only about evaluation for improving community engagement, and some of these challenges also make engagement evaluation more tricky. One of these sets of challenges is around the high degree of variability that there is in community engagement, including what community engagement is actually understood to be, but also around each of the key components of community engagement. So for instance, the community engagement, the terms used and the ideas overlap and have grey distinctions with public engagement, with patient and public involvement, with stakeholder engagement, policy engagement. When you look at community engagement, often the actual goals of doing the community engagement are not entirely clearly articulated. And when you try and get behind why community engagement activities are being done, you can see that there are often quite a few different goals or reasons for the engagement. And sometimes those reasons can pull in competing directions. There can be contentions between those goals. There's also variability in the guidance around community engagement and in what's considered to be engagement practice. So there's a lot of variability. But another challenge is that when you actually look at community engagement activities and evaluations, they tend to emphasize the activities and the interventions themselves. So for example, what happens in community advisory boards, radio shows, dramas, in the formative research, rather than trying to look at the nature of the interactions or relationships behind those interventions and activities, the underlying mechanisms and outcomes that look at if and how community engagement is actually working to achieve those different goals. And this is a challenging emphasis, not wrong emphasis, but it's a challenge that the emphasis is there rather than on those underlying interactions and relationships, because community engagement activities are essentially complex social interventions where many different stakeholders are involved, relationships change, the processes involve change over time, over space. And so it's really critical that relationships, that context and that culture are understood. Next slide, please. So I think those slides give you some of the rationale for conducting a realist review. So there's really a need for more understanding about how engagement actually works. And realist reviews are really considered to be excellent reviews for understanding these types of complex interventions that I've just described. Realist reviews are also good for avoiding hierarchical views of evidence. So many types of reviews might well prioritize, for example, randomized controlled trials over in-depth ethnographies. But given the complexity and the relationship-based nature of community engagement, that isn't appropriate for evaluating and exploring this area. There have also been some real successes in doing realist reviews in related topics and areas, for example, in community development and public health. And what realist reviews do in realist terms is develop and iteratively test program theories, which is essentially about understanding how particular types of activities work. So looking at the context, mechanism, outcome relationships in different topics and areas. And we were really keen to do that for community engagement because that's needed for the reasons that we've just outlined. Next slide, please. So there were many of us who are actually becoming increasingly interested in conducting a realist review of community engagement. So Dorcas, myself, many other colleagues at the Kemri Wellcome Trust program in Kenya had been working on implementing community engagement activities and evaluating them for quite a long time. And we were really keen to work across our different papers and our different case studies to understand those underlying mechanisms and to explore if and how community engagement works to achieve different goals. Jim Lavery and Emma Richardson, at the time we were thinking about writing the proposal for this realist review, had just completed a ginormous review of the literature, a different type of review, a systematic review. And they'd included in their review nearly 100,000 papers. And one of their key conclusions was that there was insufficient conceptual architecture in those papers to pare down logically what was going on and to learn meaningfully from that. So they were very keen on this different type of review. Robin already had expertise and experiences on complexity sensitive evaluation, including realist evaluation. And we were all working with Robin, who was already advising the Wellcome Trust and many of us in the Global Health Bioethics Network, which works across different settings and includes Paik Young, who's with us today in Thailand, and us at the Kemri Wellcome Trust program, is already advising us all on community engagement. And this felt like an appropriate direction. And Jeff Wong, who's a well-known realist reviewer, was really interested in applying his expertise to this particular topic. Next slide, please. So we were really delighted when we pulled together a proposal, and this was funded by Wellcome Trust. And in January 2019, we pulled together the whole team, including those I've just mentioned, but also Bipin Adhikari and Claire Duddy, who became part of the core team. And we were really pleased to have as content expert advisors, and Robin will come on to talk about the process with realist reviews, but they were advisors throughout the process. All of these people listed here, including Paik Young and Dorcas. And a broader advisory group included colleagues with expertise in malaria, in global health, in bioethics, in funders' requirements, needs and interests, and in community participation. Next slide, please. So that's a bit of background to why we were interested in conducting the realist review, and I'll hand over now to Robin to talk us through the process.
Thanks, Sassy. So I'm going to say a little bit about realist review processes, which some of you may be more or less familiar with, and then do a tour through some of the findings of the review before passing over to Dorcas. So a realist review process, the core of it really is looking at what we call program theory. And really this is a sort of explanation, an explanatory account of what is going on in any particular instance, and in this case, community engagement. So you begin a review by looking at sort of key literature, but also drawing on practitioner and scholar insights as to what is really going on in something like community engagement, and getting your first best guess program theory in a way, understanding those sort of causal mechanisms and processes that go on in community engagement. And it's really this that you then test by looking at literature to see whether it's supported or refuted by that literature as you go forward. An important step in realist review is focusing it, because the volume of literature is enormous and you need to make it manageable, but also focus it on the key things that you're interested in. And in our case, we focused on malaria research, partly because of the expertise and the tacit knowledge in the team, but also very pragmatically to make it doable. Once you've got the initial program theory, you use this to guide systematic searching of published literature. And then you use that literature to look at the program theory. There's a dialogue between the evidence and the theory. It's a very iterative process, it can be quite convoluted. And in the process, you refine the initial program theory. It may also require doing additional searches. And in our case, we had to draw on additional literature where our program theory, that is our explanation of community engagement, was a bit thin, or we had limited data in certain areas. And we published a protocol paper for the review on Welcome Open, which is available, which gives you a little bit more of a detail on the steps involved. Next slide, please. So many of you will be familiar with these search diagrams for systematic reviews. In total, if you look at the green box at the bottom, we covered 252 documents in the synthesis. About 195 of these were malaria literature, which we gathered in the systematic searches to test our theory. A group of papers gave us our initial program theory, our initial explanatory account of community engagement. We also drew, if you look at the left-hand side, on conceptual resources, essentially social theory and psychological theory about what is going on in particular relational dynamics and particular settings, to sort of give our review a kind of solid conceptual basis. And we borrowed on these to sort of help us with the analysis, which is something commonly done in realist reviews. We also relied on what we call, if you look on the bottom right, sibling and kinship documents. Sibling papers are really where we have a paper in the main review, where there are other papers which talk a little bit more about the process or the context or the implementation. It gives you a more rounded picture of that particular paper, that particular intervention, and gives you more to go on when you're looking for particular contexts, whether outcomes were realized and what kind of mechanisms were involved in making those happen. And kinship documents tend to be more around conceptual themes. So if we had a weak area looking at field worker relationships with local communities, there might be other literature that's outside of malaria research, which can give us some insights into what might be going on there. And again, it's something that you do in realist reviews to try and get that program theory, that explanation, as clear as you possibly can. Next slide, please. So zooming out overall, looking at the literature that we reviewed, there's a few things to say about it. One is that the literature tended to be very descriptive. So there was actually quite a little detail on the context and the outcomes that we wanted to sort of understand. And this was partly because community engagement often wasn't the main focus of the paper. It might be that the paper was really reporting on a malaria trial and community engagement was seen to be a little bit incidental, but really the paper didn't really give you a lot of detail to go on. There tended to be some aspirational commentary in papers about the purpose, the need for community engagement, but actually the paper didn't really document that kind of engagement or what actually happened in practice. So there was a tendency to talk about it in generalities. And it's fair to say a lot of the literature was quite atheoretical. In that sense, there was very little explicit account of how community engagement was expected or understood to work in the paper that was reporting. Where there was theory, it often tended to be borrowings from behavior change or social marketing, which many of you may be familiar with from sort of international development work. And rather than them being used systematically, these were just sort of, in a sense, name dropped as bits of theory that might be relevant, but they weren't really deployed in the paper trying to understand community engagement systematically. There was a significant body of qualitative work within the literature, which was invaluable for actually starting to understand some of the causal dynamics and processes and some of the important contextual influences going on in community engagement. And they were really key for us developing more rich explanations of community engagement as we did the review and as it progressed. Next slide, please. So I'm going to very top line whiz through the findings from the paper, and obviously these are available in the briefing papers and in the welcome open paper, which gives the full account of the process and the findings. The core thing that we really found where the data was richest was that community engagement relied on a sense of working relationships between researchers and local research stakeholders. That was the sort of core of the review, if you like, where a lot of the data rested. But we also found some interesting things about the more immediate context, which was essentially the culture of engagement in research institutions and whether that contributed to these relationships or not. And finally, there was an outer layer, that what we call the dominant health research paradigm context. This had a really big influence on what was achievable in any community engagement intervention. And I'll say a little bit more about all of these in turn. So if we can go to the next slide, please. So this core dynamic of working relationships was actually made up of 4 mutually reinforcing dynamics and became apparent in the literature that we reviewed. One of the key things was exchange and negotiation of benefits from participating in research. And one of the sort of strongest findings that came out from the literature was the importance of access to healthcare accompanying research participation for many people who got involved in research. And this was a really, really strong finding. There were other kinds of negotiations involved, but access to healthcare was really key, particularly in contexts where access to that healthcare was quite limited. Another important part of this dynamic of working relationships was people having a sense of influence over the research. Now, this wasn't formal accountability, and this was more a sense of maybe through local leaders or local people involved, people felt they had some kind of an influence on how research was conducted and how it was going on. A related dynamic was researcher responsiveness, and this could be really anything from people feeling they were listened to and being respected, to particular concerns that they'd raised being heard and sometimes responded to more concretely. And the final part of this dynamic was what we call researcher contiguity and familiarity. And this was really about the presence of researchers, usually in the person of frontline research field staff, in communities with local stakeholders, having ongoing interactions, building familiarity and relationships with them. And all of these things tended to contribute to greater acceptance of research and participation. Next slide, please. Now, supporting the establishment of these working relationships, there are a number of things about the engagement being conducted by research institutions which contributed. These included senior research staff and the institution leadership having a culture of engagement, sort of habits of doing it, expectations that it would be done, and a track record of doing it. Having dedicated roles for engagement was also a key part of this commitment, and providing supportive supervision for research field workers and engagement staff who have quite a complex intermediary role was another way that the culture of the institution supported engagement. Having social science and other expert input into engagement strategies was another important factor, as was reflecting and evaluating on engagement and allowing that to inform the management of research. This wouldn't always be formal. Sometimes it was more informal learning spaces. Sometimes it was formal evaluation. And supportive funders was quite key as well in terms of providing the resources that would then allow the space and the initiative of engagement to take place. Next slide, please. And finally, one of the key factors we found was the influence of what we've called the dominant health research paradigm. And this was made up of a number of different things, which were part of the kind of what might seem more distant context, but had very real effects in the everyday interactions of engagement. One of these was the setting of research often being linked to colonial administration or vertical health campaigns in the more or less recent past. Research institutions are usually relatively wealthy institutions, or among the relatively wealthy institutions in a place. And this meant that there were often differences of wealth, power, and culture between researchers and the communities surrounding them and the stakeholders engaging with research. There was more or less a perception of external funding and control of research priorities and design. This was more or less apparent in different places, but could be linked right up to the sort of global health organizations that may determine research priorities, but also at a number of levels within the national and the local context. And the final part of this paradigm was the fact that research ethics tended to focus on individual choice, autonomy and consent, and really trying to do a lot of work to get sure this consent was on paper and was seen to be done properly. But this tended to obscure the fact that people's decision making was actually constrained by a lot more of the wider contextual factors than things that were going on in the individual encounter with the research. Next slide, please. So to conclude briefly, I think what the review highlighted that community engagement was more about developing these working relationships than any particular technique, activity, tool or method, and that it was really important to do community engagement with an understanding of these relational dynamics in engagement, but also the important influences of the context in which it is done, which tend to be ignored in a more technical approach to engagement. One of the challenges that it seemed that developing these working relationships across difference tended to accommodate and reproduce the current dominant paradigm in global health research. That's to say that the very relationships that help get that research done rest on some ethically problematic aspects of global health research as it is currently configured. The analysis also hinted at an alternative dynamic of what is often called collaborative partnership in the ethics literature. We weren't able to systematically explore this in the current review, but there were enough kind of signs of this that we thought it was an important thing to highlight in our findings. Next slide, please. So just to reiterate that last tension really that came out of the findings of the review, we were left with this picture of engagement potentially reproducing some of the dominant characteristics of health research as it is done, with some of the attendant inequalities, but also some of the logic of the relationships that were involved potentially could challenge that dominance and change things if it was taken in a different direction. And with that, I'm going to hand over to Dorcas to say a little bit about some of the recommendations that have come out of the review. Over to you, Dorcas, and next slide, please.
Thank you, Robin and Sasi, for very good background to the Realist review and the findings and the conclusion. So moving forward, some of the recommendations that we came up with is that, and again, based on the fact that most of the health research is happening within health institutes, health systems, that health research should maximize opportunities to strengthen the health services and systems. That there should be careful consideration that and a move towards strengthening engagement at inceptions of research. Most of the engagement often happens when protocols have been approved, research questions have been set. But attention given to moving that engagement to even prior, at very early stages of research, but that also requires that funding is flexible to accommodate those phases. That is funding for engagement at those early phases of research. Importantly, and that is coming through both because of the relational nature that is very much embedded within engagement, the central role of frontline research and engagement staff, and that they need institutional support. And that engagement is not just about specific studies, but a broader engagement, what you call program engagement, which goes beyond just specific studies, but talk perhaps generally about what health research is, why health research is important, what happens within programs. Recognizing again this global health research paradigm in which engagement is happening, therefore engagement cannot be devoid or cannot be divorced from the political and ethical nature of what is happening within global health research. So giving attention to that, and as Robin has also suggested, there was a need from the review to start looking at more collaborative partnerships and participatory approaches and what those might bring up when you think of engagement. Again, because the focus was very much on malaria trials, and that might have limited what you could have learned about participatory approaches. Next slide. The other set of recommendations is on focusing on building relationships, and going beyond particular research studies and considering not just for the period of that research study, but more long-term, because relationship building is also a long-term activity. It's not something that you do once in a while and end it there. As was very clear from our review, that theory of changes are normally not quite explicit. So this is a recommendation we are making, that better planning and evaluation of engagement need to make more explicit theory of change. There should be clarity on the scope of stakeholder input, at what point stakeholder input is being sought, who are the stakeholders, what kind of input, what the mechanisms, and how that might change. And that will be responding also to the this relational aspect of listening and responding to concerns, as well as providing accurate information. Often research and engagement staff might be very focused on clarity of message, but sometimes may not always take good account of the relationships and how important listening and responding to concerns and views of the stakeholders are. Next slide. So we've, from this review, we have a number of outputs. Some of them are already there, out and have already been shared on this chat. The Welcome Open has published the full paper. Commentaries in preparation. We have 2 briefing papers, one for funders and research institutions, another one for engagement practitioners and researchers. We've developed an animation for the review findings, which I'm going to share shortly. And all these materials are hosted on the MESH website, and there's a link for that, which has also been shared on the chat. In terms of disseminating these findings, there are a number of opportunities that we are making use of. Obviously, webinars like the one that we are participating in. We have had a number of meetings, and these ones are continuing, and we are also disseminating amongst our networks. So next slide, at the next slide, we are going to see some of the review briefings. Or these are also available, and you can find them in the MESH website. These are easy, accessible, easy to read, get the key messages. Most of them are 4 pages, 2 pages. So please do look at them, and because I think it's a very nice summary of the key findings of the review. Next slide. So as we've said, this review involved many people, and we thank them all for dedication in this work, the real team that led by Robin, the content experts, the advisory group, and of course, Welcome Trust for funding this review. Without the support of each one of you, it would not have been possible. Next. And what we are going to do now is a shorter animation video which summarizes this review. I hope it works.
In recent years, there's been an expansion of community engagement in health research as its benefits become more widely seen and understood. Community engagement is also known as community participation or public and patient involvement, and it is often understood as a range of activities that it encompasses, such as community meetings, setting up advisory boards, or involving local stakeholders in the design of interventions. However, what community engagement is and how it works in practice is far more complex than it might first appear. A review of published papers on community engagement in malaria research trials in low and middle-income countries highlights its role in enabling the development of precarious working relationships between researchers and local stakeholders. Rather than any specific engagement activities, it is these relationships that lead to greater acceptance and participation in the research by stakeholders, even though their motivations differ from those of researchers. While researchers may aim to produce high-quality research, in countries with under-resourced health systems, a primary motivation for local stakeholders to participate in the research is the accompanying benefit of access to healthcare. So these relationships rely on the exchange of tangible benefits by both researchers and participants, and are built and maintained over time by respectful and considerate interactions. There are also wider contextual factors that, while not always visible, are powerful in shaping relationships. For example, behind the interactions can be important differences, whereby senior researchers who are employed by universities or research institutions are in a position of relative wealth and power compared to many local stakeholders. In settings with high levels of poverty, the exchange of healthcare for research participation may leave people little choice but to enroll in the research, despite any concerns or misgivings, sometimes called structural coercion. The fact that high-income countries fund and control much of global health research can also undermine relationships, as local stakeholders may have less sense of control over the research. This may contribute to research not reflecting local priorities. Overall, the findings suggest that while the development of working relationships between researchers and local stakeholders helps to get research done, these relationships may rest on ethically problematic aspects of the way much global health research is typically carried out. If this is not acknowledged and challenged, there is a risk that community engagement entrenches rather than changes existing inequalities. To address these ethical challenges, researchers and funders must pay greater attention to the relational dynamics of engagement and consider wider contexts that influence these relationships. More structured support of frontline research staff by research institutions would help them navigate these relationships, but the wider context also needs to be addressed. Recognizing that access to healthcare is a primary motivation for research participation in some contexts suggests a need to consider how the infrastructure of health research could proactively support health systems in these settings. Relationships built through community engagement should complement and feed into engagement with health policymakers and managers to expand local ownership of health and research agendas. Ultimately, community engagement has the potential to help improve connections between health research and health systems and strengthen the ethics of research.
Thanks very much, Dorcas. And now I'm going to hand over to Professor Baek-Kyung Choi to just give us some reflections on that presentation and the findings. Over to you, Baek-Kyung.
Thank you, Robin. So thank you for such a rich presentation and to all speakers. So I'm the head of engagement at the Mahidol Oxford Tropical Medicine Research Unit and have been involved in engagement for 15 years and primarily in Southeast Asia. Firstly, I'd like to congratulate the team in completing this enormous task of reviewing the engagement literature and conducting this review using a realist lens. The team has examined the dynamics of engagement with health research using large malaria studies as an example. They've produced a large range of convincing findings relevant to engagement practitioners, researchers, ethics committees, and funders. They have not only provided evidence that engagement works, but also how engagement actually works. This, to a certain extent, provides reassurance to those conducting engagement and research teams who are passionate about engagement. This also raises a few important things. That engagement with communities should be taken seriously. Relationships between researchers and communities should be taken seriously. Funding and commitment to engagement is important. This means that we do not just pay lip service or ticking a box, but truly invest in community engagement and do it well because it pays off. What does it mean for all of us? This is my take. Firstly, for community engagement teams, well, firstly, I think they should exist and they should be well-resourced and teams should be well-trained. Secondly, engagement should be part of our health research culture, should be embedded within a research institution or research teams. So what are the next steps? Many. And for that, maybe the next immediate steps for the team would be to work with researchers and engagement practitioners to consider the review findings and implications on engagement practice. And this can be in terms of a series of stakeholder consultations. And stakeholders could comprise policymakers in research, researchers themselves, field workers, frontline research staff, ethics committee members, and funders. Stakeholders could also include those working in well-funded institutions and those who are working in less well-funded institutions. Researchers working in malaria and also non-malaria settings. I mean, there are a few questions about the applicability in other settings. Also with researchers and stakeholders who live and breathe engagement and those who do not. So what we want to know from these stakeholder consultations are to what extent these findings resonate with these stakeholders. What are the implications on policy for funders, research ethics committees, and research ethics guidelines? What are the implications on practice? How should we do things differently? How should we continue to do things? How should we encourage those who do not yet do community engagement to do community engagement? And how can we change the culture in global health research? And finally, what are further research gaps? And what type of future work is necessary to advance the field? And finally, again, congratulations to Professor Ceci Molyneux, Dr. Robin Vincent, Dr. Dorcas Kamuya, and team for building on the much needed evidence on engagement and for advancing the scholarship of engagement. So these are my reflections. Many thanks indeed.
Thanks a lot, Baek Yong, for those reflections. And many of the questions you raise actually do resonate with some of the questions that are accumulating in the Q&A box. So what I'm going to try and do in the time that we've got left is maybe group some of the questions and see if the team and myself can answer those, and to sort of pick three initially. We've got a few around the difference between realist review and systematic reviews. We've got a few around the sort of applicability of the findings to other areas of health, other settings. And we've also got a few around sort of community voices, where were community voices in the review, and is there potential to sort of build on the review to enhance community control? So what I'll try and do is pick those and relay some of the comments into the discussion and let some of the panelists reply. A very quick one, which comes from Matthias Sahani, is the differences between realist review and systematic review. And I don't want to go into a lot of detail, but essentially a realist review looks for an explanatory account, really an understanding of what's going on in the process being reviewed, whereas systematic reviews tend to look for whether something has worked or not and give a kind of average effect size. But I recommend if you want to know more, if you look at the papers on Wellcome Open, we do go into some of those differences a little bit more. We then have some questions around the applicability of the review to other areas. So Doreen Tembo has asked whether the review findings can be applied to other areas. We've also had a question from Edna Juga about why we picked malaria. What about HIV? What about TB and other areas? So what I might do is let the panel respond to that one, and then we'll come back to the ones around community control. So who wants to have a go at that one about the applicability in other areas and why malaria?
I'm happy to start, Robin, and then others may wish to chip in. Yeah, so the reason that we started with malaria is that there's quite a range of different kinds of research being conducted around malaria, from kind of community-based efforts at understanding how malaria is responded to in communities, how bed nets are used, etc. There are trials of malaria drugs or vaccines and so on. So it was an area where there's a large amount of activity in global health research. It's often a priority in many LMIC countries, and in those of us who were involved in the review had been involved in various different types of community engagement activities and evaluations in that area. So that was one of the reasons that we started it just as an entry point and as an illustration or tracer of large research programs involving international groups and being conducted in LMICs. But I think as Peik Young was suggesting, our own sense from being involved in lots of different types of diseases and lots of different types of research is that the findings are pretty widely relevant and not only relevant at all to malaria research, but we'd really like to cross-check that and to consult with different stakeholder groups to see what some of the key similarities and differences might be with a very different entry point. So an area that might be potentially different, I think I saw a comment on WASH interventions. I mean, that might be interesting to think about what the similarities and differences might be there. Climate change research feels really quite different in many ways. Mental health research, these are all areas that are receiving significant investment in terms of research currently, really key issues, but engagement activities and evaluation outcomes might be quite different. So we're really keen to set up a series of consultations around that and to learn exactly that. I don't know if that helps, Robin.
Thanks, Sas. I might move on because there's quite a few questions to a cluster around community involvement. So Edna Juga was asking actually who's involved, or who are the people involved in the review that we did. So it's important to clarify that 147 of our papers focus on Africa, 52 were broadly generically international, 28 Southeast Asia, and then 6 in India, Oceania, and Latin America. So quite skewed towards Africa. But in terms of community perceptions, only a handful of those papers were qualitative studies on what communities' experience of engagement were. And to link to another question, Pascal Scherner was asking about what is actually feasible when you're looking at international trials in terms of engagement. And it is important to remind everyone that our systematic review of literature was around large malaria trials. So there are some things about the trial protocols which inherently limit, you could argue, involvement, but still questions around how much consultation there was around the research themes and priorities. But to cut to a core of the questions, Erica Nelson and Jill Black were asking if we flipped around the review and looked very much more from the community perspective, how would things look like? And indeed, how might we extend the review to build on what we found and look at sort of actual community control and research? And I think that's a really challenging and important question. My little take on it before I hand over to the team is one of the things that came out of the review, because we were focusing on trials and malaria and it was relatively contained, we were getting hints of the importance of participatory process, but we really couldn't look at it systematically. And one of our ambitions is to extend the review to look more systematically at participatory engagement and indeed research that embeds participation within it. And the nature of our review is it was limited, it was contained by the literature that we looked at, but I think those are really, really key points. But over to the rest of the team in terms of any comment on that sort of important community focus and looking at participation.
I can quickly. I agree with what Robin has said. I think the focus in which you went with the malaria research perhaps limited how much we can look at other approaches. I also saw the question which was asking, supposing the review itself was informed by the community point of view. And I take that as a really interesting way to frame even the review itself. Obviously, there will have to be some, and again, I'm looking at Robin as the expert here, in terms of when we are talking at what do we focus on, because there was a lot of conversations, how do we focus? Bringing together people, including community members, to discuss what is the review about, what kind of questions, what would be interesting to learn about, does that then inform the whole review? I think there's potential to do that. We perhaps for this initial one didn't do that, but perhaps as Robin has said, there's more work that we immediately identified, and there's potential maybe even to review how we did our work and to expand who the stakeholders were who are involved in the review process itself.
Thanks, Dorcas. And Sassy, did you want to add?
Yeah, thanks, Dorcas. I think one thing that we attempted to do, and you might want to comment on how easy it was and valuable to do this, Robin, but we did attempt to share some of the early ideas around the program theory as it was evolving with representatives of community members in places where there was already a reasonable relationship with community members, so that they might understand why it is we're doing what we're doing and be able to confront and challenge us in ways that felt comfortable. So we did try to do that, for example, with community representatives who are elected by community members in a part of Kenya. But that wasn't the starting point of the review, and it's definitely challenging to have that kind of consultation around these types of findings.
Thanks, Sassy. Yeah, and I've forgotten the thread I was going to link into that, annoyingly. Okay, I'll see if it comes back to me. In the meantime, a couple of other questions that have been raised. Sarah Dada was asking whether any questions that we felt were left unanswered, or what do we actually see the next steps, implications for the future research in this space. So that's one question it would be good to look at. And another comes from Noni Mumba asking about the role of trust in some of the work that she's done. Trust between researchers and communities seems to be very important. She's wondering how we, whether that surfaced in the review or where that came up. So the latter one I certainly have something to say on, but I don't know whether Sassy or Dorcas, you want to say anything about sort of things that were missing or next steps?
Dorcas, I noticed your hand went up and went down. Did you want to add anything earlier?
Yes, I just very quickly, I think there was a question that was asked on how communities or community engagement can also handle what we are calling the global health paradigm, the existing and how it can challenge, and whether that is even feasible. I think a couple of questions were about that, and I wanted to quickly contribute on that. There are quite a number of initiatives that are even requiring researchers to, before even they can put in a protocol, before they can put in a research question, they should have consulted communities involved, patient groups. And I think that is a process of starting to flip the side so that the research is addressing the priorities of the communities. Many funding organizations are also saying it's not just researchers to make their research questions, but that they need to involve the Minister of Health stakeholders, all the stakeholders who have got priorities, who are making the priorities for national level agendas. And I think that is one way in which the community voices and stakeholders, non-research stakeholders, then get involved and contribute to the research activities, including what is being prioritized. That is a very quick feedback, but I also know funders are really investing funding into those initial steps of prioritizing research agendas.
Thanks, Dorcas. And yeah, the point that I forgot or lost was essentially, in some ways, our review highlights what you might call common current practice in large biomedical trials. And there was certainly an impetus within the team to look much more closely at participatory engagement or processes. And it's fair to say that in the literature that we looked at, in that more common, well-funded current practice, there was very little of that. And it seemed important to be able to actually say, well, this seems to be actually what is going on in engagement as the way it is often done, conducted internationally. But many of us had real interests in this potential alternative process of collaborative partnership, which reared its head within our review, but we didn't look at systematically. So I think that links to some of our ambition to extend the review, but also the limits of what we found. Picking up on Noni's question about trust, I think one of the things we found in the literature is lots of people use that term very loosely or very aspirationally. As soon as we've got trust with communities, and everything is okay, engagement happens. We found that it was a very woolly, very unsystematically used concept, and actually what was going on from an analysis of the literature was much more of what we called a working relationship. It's some benefits on one side, provisional acceptance or involvement, rather than this sense of trust gives you a wholehearted once and for all connection. But it was much more provisional and precarious. And naturally, if you think about the differences of power and wealth in that setting, the idea that trust would suddenly be established, it seemed to be what is often called a weak analytical term in sort of realist analysis. So we strayed away from it. But it's true, as you say, Noni, the language of trust was used a lot by people, but we chose to try and sort of put a question mark around it, I suppose, looking at the empirical findings that we had. Sassy and Dorcas, I don't know whether you want to say any more about Sarah's question about sort of gaps or next steps, the kind of the way we hope to complement the work we've done so far. We've only got about a minute, I'm afraid.
No, just to really agree with the comments that Dorcas had there. And I was just thinking about the trust comment from you, Noni, and I think in the Can We Welcome programme, our hesitation around the word trust has led to us over time sort of trying to talk about aiming for a healthy mistrust so that we can be questioned and accused and you know, asked to behave differently as researchers and as an institution. So I think that's another example of how we've tried to move away from just trust as a label on its own.
Thanks, Sassy. I'm afraid we're out of time, so I'd like to thank everyone for their participation and say that we will try and answer any of the unanswered questions through the Mesh Hub. And we are, you know, do watch this space. We're very interested in taking this forward and developing it in a number of the ways that many of you have highlighted already. So thanks again, everyone, for your participation, and thanks for the panel for some great contributions. And with that,
Thank you.
Goodbye.
goodbye.
Bye.
Bye.
Thank you. Bye.